Well, good morning, everybody. It's the third Friday of the month, which means it's our monthly and on tap conversation. Excuse me, almost launched into our all things advocacy script, although that's coming up soon, pretty soon too. The North Dakota legislative session is just around the corner. Our normal host, Kathy Schwann, sends her regrets. Unfortunately, she wasn't able to make it work today, so I'm pinch hitting for Kathy today, and super excited to have this conversation with you today and welcome you to this month's on tap conversation. If you remember last month, I joined Kathy to talk a little bit about our utility work and the work that we're doing. And this month, we're going to shift our conversation a little bit to talk about an update and some updates on some important legislation that was just signed into law on August 16th, the Inflation Reduction Act of 2022. And as you see on your screen, our guest has joined me. Our guest, I'm going to warn our viewers right now, my guest and I are friends from almost my start at AARP. So we're going to try and not run long, right, Scott? It was part of it. So I want to welcome Scott Musser. He's the field manager with AARP Campaigns. How you doing, Scott?
Great, Josh. Good to see you. Thanks for having me on.
Absolutely. We're happy to have you here and excited for you here. You know, Scott, I know we've been talking about reducing drug prices since I started at AARP over 12 years ago, and that it's been a priority for AARP nationally. I know our viewers know that we've been working on that here in North Dakota as well. And it's super important for obviously me, but others across the state of North Dakota. And so it's been a busy and kind of exciting couple of weeks. And as I mentioned earlier, the president signed the Inflation Reduction Act this week. So can you give us kind of a brief summary of what was included in the bill and why this is such a historic win?
Yeah, sure, Josh. Yeah, like you said, I mean, this is something that's been around. AARP's been working on this issue for decades now to try and actually, do what we can. And we've had some good wins along the way, and especially a lot of state offices. But this is just like such a tremendous historic win to actually get this done on the federal level through Congress. We know millions of seniors will soon get relief on out of control prescription drugs. So basically what this bill does, kind of a couple big things that will also help not only make prescription drugs more affordable, but also help save some lives along the way too. It's going to allow Medicare finally to be able to negotiate prescription drug prices. We know that's been prohibited for a number of years. Medicare is one of the largest users of prescription drugs because all the millions of seniors that are in the program, where they can go out there and negotiate it. They can even get the best deals out there. It's also going to help limit the cost of insulin to $35 per month for people on Medicare. It's going to help penalize the drug companies that we've been seeing over the last couple of years where they're increasing their prices at just crazy rates, often much more times higher than the price of inflation. That just makes it unsustainable for folks to be able to stay on their life-saving medications. And then it's also going to give people in Medicare drug plans peace of mind knowing that they won't have to pay more than $2,000 a year for their medications. So that's just a great savings there for folks, knowing that they're not going to have to worry about that. And then one of the last pieces that's going to help a lot of people, there's a lot of vaccines out there that people are taking. This is going to make sure that the vaccines like the shingles vaccine are available at no cost through Medicare. So that's going to help save people a lot of money and make sure they get the vaccines they need to stay healthy.
Yeah, I think, and I know we're going to hear from our CEO, Joanne Jenkins, a little bit earlier, but I think in her statement, she called it a historic day for AARP and the work we do. It's incredible to think about it. I know I've heard it from folks a long time about Medicare negotiating the price of drugs and then that out-of-pocket cap being lowered to $2,000 a year. Great. So, Scott, great to hear. Great to hear those are the AARP priorities that got included and that we were supportive of. Did they all go into play right away, or how does this law get implemented? Can you tell us a little bit about that?
Yeah, great question. Unfortunately, not everything goes into effect immediately. As you mentioned, the bill became law this week, thanks to President Biden signing it. But we'll sort of start off, first thing this year, later this year, the drug companies that have been increasing their prices faster than inflation. We'll start rolling that back, making sure that, we'll put provisions in there that address brand name drug companies doing this. Will help reduce the prices that seniors pay for the drugs plans and through both their premiums and through cost sharing. So that's one of the most immediate things. We'll start rolling that back. And then starting early next year, the co-pays for insulin will be capped at $35 a month for people in Medicare. And then they'll no longer have to start paying for these vaccines that they take, like I said, shingles and other things out there. And shingles right now, that vaccine's about a $350 price. So, I mean, that's some real money that people are going to be able to save starting early next year. And then, of course, there are other provisions that help seniors save and save Medicare money as well, like the caps on out-of-pocket, payments in Part D, requiring Medicare to negotiate the lower drug prices overall. And that's going to take some time. Like anything, there's, levels of bureaucracy. We got to set up the rules. We got to implement it. So, AARP behind the scenes going to be working with people throughout the federal agencies to help get these in places and try and get these online as quickly as we can. But we know it takes some time to get it out there.
That's great, Scott. Thanks for that additional detail. And Janelle, who's behind the scenes and our advocacy director, who those of you watching probably know, or if you don't, connect with her because she's doing some great work for us in North Dakota on prescription drug prices as well. She's going to put a post to the blog in the blog post that Scott was mentioning or referencing that kind of lays out the specific timelines of those things and how they'll get implemented and when they'll specifically go into effect. Scott, I've noticed in everything you talked about, we've been talking about lowering prescription drug prices in Medicare. So it's pretty clear we know what this bill does to help people in Medicare. What are some provisions in this bill that AARP fought for and are excited about to help folks that are not on Medicare?
Sure. And first of all, we know there's about 60 million people in Medicare. A lot of them, are using anywhere from 4 to 5 drugs per month. So that's, a big market. And that's why a lot of this focus is on that. But for others on there, it's also going to help keep health insurance affordable for millions of Americans who are not in Medicare by helping expand the premium assistance that was first part of the American Rescue Plan Act. This is especially key to people that are in that 50 to 64 age group. So they're not quite eligible for Medicare. So, we want to make sure that they are able to afford their health care. And we know a lot of times with those people too, because of their age, they get subject to the age tax, where they can often pay, up to 3 times as much for their insurance compared to a lot younger people out there. So that will help bring down some of that cost for them, make sure that they can afford to get the health care that they need and access to the prescriptions and other services they need until they get into Medicare. We also know that, as a result of this, the enhanced financial assistance, the annual out-of-pocket premiums for consumers aged 50 to 64 decreased by an average of 16%, which is about $950 annual savings. And then there are more than 1 million gained affordable health care coverage through this. So extending and expanding this policy will make sure that healthcare is more affordable and accessible for a lot more people out there. So, instead of making it, having it be expensive, not being able to reach it, more people will have access to it. And it'll help people in the long run be healthier and live better, longer lives and make sure that they have the resources they need.
Thanks, Scott, for that good summary and appreciate that feedback. I will say this, I was having a conversation with someone the other day who said, hey, now that Congress has passed the Inflation Reduction Act with all the prescription drug provisions, I suppose that means you don't have to do work next legislative session in North Dakota about prescription drug prices. And this is one of the areas I pointed to. And I said, hey, there's a whole bunch of people under the age of 64 who aren't on Medicare that could use some help as well. And that states have real options of solutions that they can take as well. And so if anyone's wondering, we're still planning to do work next legislative session on prescription drug prices. And I suspect in the coming months, we'll be talking more about that as we get closer and closer to the 2023 North Dakota legislative session. Scott, we've been talking, you said earlier that AARP has been working on this for decades or over a decade. How did we finally get this done? What tipped the scales here? I know pharma's had a lock on, especially the Medicare negotiation provision for a long, long time. How did it get done?
In like a lot of ways, we've continued to build off the effort from year to year, decade to decade. But I think it was a culmination of everything, the right timing. I think we finally, were able to get not only the public's attention on this, the media's attention on this, get Congress's attention on it, and leadership in Congress to say, what, something has to be done. This is a bipartisan issue Democrats, Republican voters across the spectrum support doing more to help make prescription drugs affordable. We didn't get everything we wanted done out of this, and that's like you said, Josh. It goes back to a lot of states. We'll have hopefully some great successes in their upcoming legislative sessions, and we'll continue to work on the federal level to get the things we didn't get or the next step that we learn from what we've accomplished so far. But really, I mean, a lot of this comes down to, as you said, pharma. Pharma's had a lock in it. Pharma's a huge industry, spends lots of money. But the thing we have that pharma doesn't have is millions of members and millions of people in the general public that are committed and concerned about this issue. And I think just building off of that, we've had great stories. We've appreciated all the help people have given and sending emails to the members of Congress, calling their legislators of Congress, writing letters to the editor. It was just like, I mean, in a good way, like that perfect storm. We're able to put everything that we've had, all the different resources, really sort of focus on this. But it really comes back to the power of our membership. Our volunteers across state offices, our general membership out there really focusing on this, doing everything we can. We kind of said, we pulled out all the stops on this. We made this our #1 campaign this year and just did everything we could and used every resource, every volunteer and every member we could to sort of drive the point home. And it's great to see it happen, and sometimes, like I said, sometimes it takes, it takes longer, but good things come to those who wait. And we finally got to this day and we're happy to celebrate. But as you said, it's not done yet. There's a lot of work still to do, making sure that this all rolls out smoothly. Get things implemented, and then continue to look what we need to do in the future.
And I think it's important to say thank you to those who are watching. Yeah. If you sent a message, if you made a phone call, if you raised your voice, that was super huge. And in fact, before as Janelle's queuing up, we have a video from our CEO, Joanne Jenkins, we want to share quickly here for you to see, because she wanted to make sure we said thank you as well. But as you're doing that, if you've got questions for Scott about the Inflation Reduction Act or how it got done, please ask questions either in the chat or using the Q&A button as part of that. And with that, Janelle, if you've got that thank you video from Joanne, let's share that with our folks. Janelle, I think we're having a sound issue, so you might have to reshare it and share your sound. Well, she's working on that. I know, Scott, one of the things that we're working on in North Dakota is teeing up a bill to look at price importation again, or trying to make sure that our neighbors to the north in Canada don't pay, or that we don't pay sometimes three times as much for the same prescription drug, same thing as well. And so we're working on that. And I know there'll be more news coming very shortly. We just found out the interim legislative committee in North Dakota that's handling that is meeting September 15th. And so that bill draft is circulating again, and we're going to be asking for folks to help us get that pushed across into next legislative session, because we want to make sure there's a healthy discussion about that and do that. So stay tuned for that, or you can always find more at aarp.org/ND. Janelle, do we have that video queued up, or are we going to have to send it afterwards? Technology is great when it works, folks, but right. Like all things, we sometimes have hiccups as it relates to that as well. Janelle put the link to the video in the chat for those of you. It sounds like we're not going to be able to get that to work today as part of it, but we'll make sure we also include it in the follow-up email for those of you who attended today to be able to see it in case you can't do the chat. Scott, couple questions coming in. There was a discussion. One of the questions we got is there's some confusion about the insulin cap, $35 insulin cap. Is it apply only to Medicare, or does it apply to everybody? And can you maybe just talk about how that shook out and where we ended up?
Sure. So yeah. Well, obviously we wanted and we pushed for as much as we could to get it included for everybody. Ultimately, what was in the legislation that passed and got signed into law is only for Medicare at this point, but it's another opportunity. I mean, we will look at successes and how this worked out for folks in Medicare, and the savings there will be good, because then we can take those savings back and apply them to other things. But yeah, that's something to continue to do. And we've seen some successes, this year alone, and states doing some individual caps, which is great. But we want to use that type of work on this individual state level to also drive, federal congressional action that then applies to everybody. So yeah, right now it's just a cap for insulin for people in Medicare, but we're looking to continue to push to expand that.
Awesome. Thanks, Scott. There's another question that just came in. You mentioned the $2,000 cap. Was the previous cap $7,000 or more? And can you remind folks again when the new cap goes into effect?
I believe, gosh, I'm trying to remember. I think it was somewhere along that, just kind of depending where folks were at.
Well, I don't think there actually was a cap. It had more to do with when they hit catastrophic coverage.
Well,
right?
yeah, you kind of hit your catastrophic. So yeah, the cap, there's not a set timeline for that. It's going to take a little time to get that into play because there's a lot of different administrative rules and stuff that have to get ran. So we're open. Sometime in 2023, we'll continue to push for this behind the scenes to get this up running as quickly as we can, but it's going to take a little time to get up there. So yeah, we think we'll see some immediate savings, just on keeping the drug companies from, raising their prices so fast. And then of course, the insulin cap coming in early next year, that, we'll be pushing and get this stuff out there as quickly as we can.
Awesome. And I would encourage again, and Janelle, take note, let's share that blog post in the after event email too for those folks, because in the email or the blog post, it says that the cap is supposed to be done by 2025. So that there are other things, but the actual cap, the $2,000 cap is 2025 as part of it. So there's one other question that just came in. As well. So does this legislation eliminate the donut hole? Great question.
Yeah, that is. It definitely goes the way. We've, actually some previous legislations basically eliminated the donut hole. This does a whole lot more to make that reality happen a whole lot quicker. And then just putting the cap on there does it so we don't have people falling into this donut hole and then struggling to get back out of it as they try to afford the prescription drug. So yeah, the donut hole was on its way out. This is just going even further to make that much more of a reality sooner.
Awesome. Scott, thank you for joining me today. This has been a great discussion. We appreciate that. For those of our viewers watching who don't know, I know Scott very well, as I mentioned, but for those who don't know Scott, Scott's part of the team at the federal level that helps us strategize and think about how we continue to do the good work on behalf of our members 50 plus in North Dakota and across. Well, he doesn't do North Dakota anymore. He used to do North Dakota. And now he has a different part of the country, but we still stay in touch and appreciate his support and super glad to have you come back and give an update in North Dakota, Scott.
Yeah, and just, just thanks to all your volunteers and members for all their efforts. Every little bit people did, this all added up to this historic win. So really appreciate everybody's effort and doing this. And, like I said, the fight's not over. We'll continue to do stuff. There's more to go, but you celebrate these big wins like this and you use this to help drive the next ones.
And on that, Janelle says she's fixed the video. So we're going to show the Joanne thank you video.
Thank our nearly 38 million members whose support enabled us to take on the big drug companies and force them to lower their prices. Together, we have won an historic victory. AARP has been leading the fight to bring down the costs of prescription drugs and make them more affordable for older Americans and their families for more than 60 years. And now, for the first time, Medicare will be able to negotiate with drug companies for lower prices, saving hundreds of billions of dollars for seniors, taxpayers, and Medicare.
Just when we think we got it fixed, that's part of it. Well, Janelle, let's just make sure it goes out and thank our viewers for coming. Again, my thanks to Scott Musser for joining us from the campaigns team. It's great to see you again, Scott, and have you here. Additionally, I want to remind you of some upcoming events that are coming up. If you're in the Bismarck area next week at 6 p.m. There's a placemaking in your community event as part of it. And it says in person, there's also a virtual version of that. So if you scan the QR code or visit aarp.org/ND events, you do that. In addition, we launch our Stretch and Strength series, our yoga series next month. On September 15th, and then we'll be doing an LGBT Lounge and Learn on housing options in the Fargo area on September 20th. So with that, again, I want to thank Scott Musser for joining me. I want to thank my teammate Janelle Mose for her work on getting this all set up. And on behalf of Kathy Schwan and AARP North Dakota, thank you all for your awesome work in helping us get across the finish. And we'll see you next month.